Have you ever wondered what would happen if the US adopted Switzerland's healthcare system? It's a fascinating thought experiment. Switzerland is often praised for its high-quality care and universal coverage. So let's dive in and explore what this massive change might look like for Americans. First, let's understand the Swiss model. It's not socialized medicine, like some might think. It's a system based on mandatory private insurance, often called managed competition. Everyone living in Switzerland must buy a basic health insurance plan from one of many private, non-profit insurance companies. The government defines what this basic plan must cover, ensuring everyone has access to a comprehensive set of services. Think of it like car insurance in the US. You're required to have it, and you can choose your provider from a competitive market. So, what's the first big change if this system came to the US? Universal coverage. Right now, millions of Americans are uninsured or underinsured. Under a Swiss-style system, everyone would be required to have health insurance. This would be a monumental shift, effectively ending the problem of the uninsured. No more worrying about getting sick or injured without a safety net. This would also eliminate the concept of job lock, where people stay in jobs they don't like just for the health benefits. Your insurance wouldn't be tied to your employer anymore. How would people afford it? The Swiss system includes government subsidies for low and middle-income individuals and families to help them pay for their monthly premiums. So, if this were implemented in the US, a significant portion of the population would receive financial assistance to make their insurance affordable. This is a key component. It's not just about mandating insurance. It's about ensuring everyone can actually buy it. This would likely involve a restructuring of how the US currently funds healthcare, potentially redirecting money from programs like Medicaid and subsidies on the ACA marketplace into this new, broader subsidy system. Next, let's talk about the insurance companies themselves. In Switzerland, the companies offering the mandatory basic plan are not for profit for that specific line of business. They compete on service and efficiency, not on trying to attract only the healthiest customers. They are legally required to accept anyone who applies, regardless of their age or pre-existing conditions. This is a huge deal. No more medical underwriting for basic coverage. Insurers would have to compete on a level playing field with a risk adjustment mechanism that compensates companies for taking on sicker, more expensive patients. This encourages them to manage care well, rather than avoid sick people. What about choice? This is where things get interesting for Americans who value choice. The Swiss system actually offers a lot of it. You could choose your insurance company from dozens of options. You could also choose different tiers of plans. For example, you could opt for a plan with a higher deductible in exchange for a lower monthly premium. You could also choose plans that limit your choice of doctors to a specific network, kind of like an HMO, to save even more money. Or you could pay more for a plan that gives you complete freedom to see any doctor you want. The power to customize your coverage within the framework of the mandatory basic benefits would be in your hands. And what about the doctors and hospitals? For the most part, they would remain private, just as many are in the US today. The prices for medical services and procedures, however, would be negotiated between the insurance companies, doctors, and hospitals, often with government oversight. This could lead to more transparency and potentially lower costs overall, as it introduces a more structured negotiation process than the current fragmented system in the US. This might mean your explanation of benefits would finally make sense. Let's consider the potential challenges. The first is cost. While the Swiss system has better outcomes in many areas, it's also one of the most expensive in the world, second only to the United States. So, adopting this model wouldn't necessarily be a magic bullet for cutting healthcare spending overnight. Premiums in Switzerland are quite high. A transition in the US would need to manage public expectations about costs and ensure subsidies are robust enough to prevent financial hardship. Another major hurdle would be the political and logistical challenge of implementation. This would be one of the biggest legislative overhauls in American history. Think about the debate around the Affordable Care Act and then multiply that by 100. Every aspect of the current system employer-sponsored plans, Medicare, Medicaid, the VA would need to be reformed or integrated into this new structure. The insurance lobby, pharmaceutical companies, and hospital groups would all have a major say, and the political battle would be intense. There's also the cultural shift. Americans are used to getting insurance through their jobs. Decoupling insurance from employment would be a massive change in mindset. The individual mandate, the requirement to buy insurance, has also been politically controversial in the US. Getting widespread public buy-in for a mandatory system, even with subsidies, would require a huge public education campaign. So, let's put it all together. If the US adopted the Swiss healthcare system, you'd likely see everyone covered by a private insurance plan that you choose yourself. You'd get help paying for it if you needed it. You wouldn't have to worry about losing coverage if you lost your job. And you couldn't be denied for a pre-existing condition. You'd have choices in plans and doctors, but within a more regulated market designed to control costs and ensure quality. On the flip side, you would be required to buy insurance, and it might still be expensive. The transition would be incredibly complex and politically charged. It wouldn't be a simple fix, but a fundamental rethinking of how America provides and pays for healthcare. It's a system that prioritizes solidarity and shared responsibility, ensuring everyone has access to care while still preserving a market-based approach with private insurers and providers. What do you think? Could a Swiss-style system work in the US? What are the biggest benefits or drawbacks you see? Let me know your thoughts in the comments below. It's a complex topic with no easy answers, but exploring these ideas is the first step toward finding a better path forward. Thanks for watching, and if you found this breakdown interesting, please give this video a like and subscribe for more deep dives into big questions. See you in the next one.